Hello everyone, my name is Dr. Vijay Bhatia. Today we are going to talk about adjustment disorder. I work in mental health and have experience in working as a psychiatrist. What is adjustment disorder? Adjustment disorder states of subjective distress and emotional disturbance, usually interfering with social functioning and performance, arising in the period of adaptation to a significant life change or a stressful life event. The stressor may have affected the integrity of an individual's social network, like there is a bereavement, separation, or other experiences, or the wider system of social support and values like migration, refugee status, or represented a major developmental transition or crisis, going to school, becoming a parent, failure to attain a cherished personal goal, or retirement. So what we are saying is that there is a significant life-changing event or a stressful life event where a human being, a person, is having difficulty in adaptation. So this disorder, adjustment disorder, arises because in any significant life change or stressful life event, we need some period of adaptation. And we expect that the person will adapt to the normal self, the what they used to be. And in these disorders, we have difficulty in arising to those adaptations. Now, the stressor or the event or the life change event or stressful event may be anything, but they're not too catastrophic where every person we will believe that would have suffered serious illness. But these are events which are stressful events, especially to some individuals who may have some kind of vulnerability. So what we are saying is this will not happen in every person who would have suffered these significant life events. Let's take examples. Bereavement. Normally, we would expect that there is a brief period of bereavement. After that, the life would get to the normal. But in adjustment disorders, the person will have difficulty in adjusting to the bereavement. And in any kind of life event, we would expect there is some kind of time period where we should be able to hopefully get back to the normal functioning level with the emotions, with the work, with other things, socializing. But in these adjustment disorders, what happens? There is lack of adaptation, therefore affecting their emotions, affecting their functioning. That's why it is called adjustment disorders. Another example is separation. So a boyfriend and a girlfriend, they separate, and the boy or the girl can't tolerate that, and they just go and take the overdose or try to kill themselves because they can't see the future without the other person. And it can happen in long stable relationships and then having separation, and they find they cannot adapt without the other person because of the separation. There might be other experiences like let's have some kind of car accident or something which is not catastrophic, where other people have not suffered so badly or severely, but this person cannot adapt to that event, that experience, um, to to cope anymore, and therefore not able to adjust, and therefore we call it adjustment disorder. Other examples are where there is a wider system of social supports and values are lost, like in migration or in a refugee status. The person moved to another country, the person might have lost their belongings, their house, their family, and other things, or other community members, and now they're lost without that, and they're not able to adjust and function the way they would have normally within that community, that society. The person is not able to adapt, and therefore adjustment disorder, or represented a major developmental transition or crisis. Even things like a person is off sick for some time in a hospital or whatever reason, and they have to go back to school, and this time there is a change, and they cannot adapt going back to school because they were getting so much care and love in the place. So any developmental transition, even from a child or in an adolescent, if they go change their environment, change their uh, loved ones, or even becoming a parent, the parent, either mother or father, may not be able to adapt to the demands of the newborn, or finances, or housing, or work-wise. They might be getting off sick. They might be not able to perform as well. They might have to keep on be awake at night, and the child may have some kind of other problems, and the mother or father may they have their own problems with emotional disorders or depression or anxiety, or they're prone to these things. So they will have difficulty adapting to the situation, circumstances, as becoming a parent, and may find it very difficult to have adjustment, therefore adjustment disorder. Failure to attain a cherished personal goal. So if there is somebody who really wanted to achieve something, or get a job, or go to a place or meet somebody, and if that is not happening, they know they cannot do that. What happens then? The person gives up. It doesn't, they can't adapt, they can't think of anything else. They are just so focused emotionally that nothing else, either this or nothing, and therefore they end up feeling depressed, sad, even sometimes suicidal. And this thing can happen. Retirement, we expect the retirement should be happy period. You have been relieved, and you got some finances, and you will be able to enjoy your life. But on the contrary, the retirement is an event where you have lost the daily routine, the structure, the socialization within that environment, and now the person is not able to adjust, and they started feeling getting more nervous, anxious, or worried, or financial worries, or support from other people, and they may go into anxiety and depression, lonely. All these things will contribute towards uh, having adaptation problem, what we call as adjustment disorders. So what we are saying is that there is an event, and there is a period after the event where the person should be able to adapt, but that person is not able to adapt, rather goes into the mental states which are causing emotional disturbance. So adjustment disorders are states of subjective distress. So the person who is in the situation feel very distressed, and there is emotional disturbance, feeling depressed, anxiety, low in mood, not know what to do or how to cope with it or manage it. That is adjustment disorder, and it can happen in any kind of stressful or life-changing event. What are the predisposing factors? And the important thing about predisposing factor is that separation happens a lot, but not everyone has adjustment problem. Normally within a period, the person goes back to work or does their usual things and they are getting normal. But some people, they can't. That's why predisposing factors are important to look at, that this person is not able to function, whereas this person is able to function. So what could be those predisposing factors in the person? So individual predisposition, or sometimes vulnerability, plays an important role in the risk of occurrence and shaping of the manifestations of adjustment disorders, but nevertheless assumed that the condition would not have arisen without the stressor. So what we are saying is, like, let's say this is a mother who has recently given a birth and she is not able to adapt, cope with the demands, the situations. Maybe she is a single mother and suffered depression either in the pregnancy or after the pregnancy, and she is not able to look after herself. She is feeling very anxious, she is very nervous. Why she is this? Because she is a single and she suffered depression in the past, or there is underlying some kind of learning problems, or coping skills are not that developed, or she is prone to other things like using alcohol or drugs or illicit drugs. And or the other situation can be that her partner is either there, and if he's there, he is alcoholic and causing problem and distress in the family, so she is not able to cope. Rather than helping, she is getting burdened. So any kind of vulnerability must be looked at. However, no matter how many vulnerabilities are present and predisposing factors are present, we would say that still that adjustment disorder would not have occurred until and unless that stressor has come. In this situation, although shouldn't be saying like that, but the mother has given a birth and that becomes like a stressful event and as a stressor. What are the manifestations of adjustment disorders? So the manifestations can vary in a very wide range, and they may include any symptoms from mild depression to moderate depression to mixed anxiety and depression to worry, or a mixture of these. And there is a feeling of inability to cope. That is very important. That is quite negative thought and symptom. I will not be able to cope with the situation, how I'm going to live without the other person, how I'm going to manage with the finances, how I'm going to keep on waking up in the middle of night and going early to work in the morning. So all these things come to the mind, and the ultimate feeling comes that I cannot cope. It is too much. And they cannot even plan ahead. They cannot think that can I get the support from anybody or other things. They can't think like that because they feel so overwhelmed. And the other important thing is they cannot even continue the way they are, because they are finding themselves very difficult. So they have no choice. They can't continue in the present. They can't plan ahead, and they cannot cope with the situation. So what they do, they go into depression, they go into anxiety, or mixture of these. And sometimes this can be a brief period, and sometimes this can be a long period. As well as some degree of disability in the performance of daily routine. So it's not only that they are feeling emotionally upset or depressed or anxious, there is a degree that they are not performing the work they would have normally done, even daily routine, getting up, washing, dressing, eating on time, sleeping on time. So all these things are affected, let alone going to work. They will stop going to work, will not be able to concentrate at work, will be rushing back. So there is a significant degree of disability. Disability is that they actually cannot do those things that they would have normally done. without that stressor. And conduct disorder is important because, especially in adolescence, they started behaving in a manner that is not right for them and put them in more problems. They either become aggressive, shouting, not listening, and started breaking things. So their behavior is disruptive, not respectful, sometimes antisocial, and they when go on to use illicit drugs or use alcohol or cannabis or smoking a lot and staying out a lot or doing other things that they would not have done otherwise. So their behavior becomes more erratic and it is difficult for others to cope with it, and for the person who is in the situation suffers very distress. The predominant features may be a brief period of depressive illness or a prolonged period of depressive reaction, and they may fulfill the criteria of actually depression and anxiety and mixed anxiety and depression. In fact, any within those mood disorders, affect disorders, or neurotic disorders, and or disturbance of other emotions and conducts. So it's not only behavior, depression, anxiety, but they can develop in other emotions, like we talked about the conduct in anger, in keep on worrying about things, in other factors as well. So for the diagnosis of adjustment disorder, so the thing is there has to be a significant life change event or stressor, and within the first month we expect that there should be adaptive period, and we are expecting within that 1 month, no matter whatever is the stressor here, even the mother has given birth or a person has migrated to another place, or there is a bereavement, or there is another change in somebody's separation or somebody going to the school. So we expect that within 1 month the person would have gone to the normal, at least functional state within the reason. However, if they do not adapt to this major event change in their life, and they cannot adapt to the changing environment, then they develop some kind of symptoms or non-functional in their daily activities, then we call that adjustment disorder. The individual manifest symptoms or behaviors disturbance type found in any of the following. We already mentioned some of these. I'm highlighting again. They can be anything from affective disorders like anxiety, depression, and even with depression it could be anything: mild depression, moderate depression, severe depression, or it could be recurrent depressive disorder, or it can be part of the bipolar affective disorder. It can develop into any form of disorder, given the vulnerability factors and predisposing factors are also available. The other thing is they can develop anything within the neurotic, like anxiety disorder, phobias, avoidance, or agoraphobia type or social phobia type symptoms, and any anxiety or somatoform disorders that a person complains that physical problems are there. My leg is not working, my intestine is not working, I cannot eat. They can develop any, even eating disorders. So they can develop any of those disorders. And we talked about some conduct disorders, that they have behavior problems, getting into problems with the authority, with the police, with the family, and ending up not achieving the grades they would have achieved otherwise, or earn the finances they would have done. So they end up doing nothing. or getting distressed and getting into more problems. And these symptoms vary in both form and severity. It can go into severe depression for long periods or for short periods. So depending on the how the person reacts to that situation, or not even react, how the person adapts to that situation, and that's why there is adjustment disorder. And in order to justify what are the types of adjustment disorders, we can say that it can be a brief depressive reaction, that meaning a transient mild depressive state. Remember, this is mild, this is not moderate or severe that would benefit from having a treatment, but this is mild depressive states where the mood is mostly low, they are not feeling that energetic. However, their functioning levels is slightly dampened but not completely out of work and place. And this is not exceeding more than 1 month. So remember, there is a stressful life event. We give 1 month for the adaptation. And if after the adaptation the symptoms are still another 1 month, their mild depressive symptoms are present, and they are not happy and enjoy their life as they would have done otherwise, they will fulfill the criteria of adjustment disorder with brief depressive reaction. Or there can be prolonged depressive reaction. Again, this is a period so this is the stressful event. We give 1 month to diagnose, and person has not had adapted to the situation, changed environment, and this low mood continues for another 2 years. They are not enjoying the life. They have become slightly slowed down and not eating as well, not sleeping as well as they would have done. So they are mild depressive state, but it can continue for a long period, even up to 2 years, and that is called adjustment disorder with prolonged depressive reaction. The third one is mixed anxiety and depressive reaction. Here both the symptoms are quite prominent. Anxiety, meaning their muscles are tense, their heart is racing, they are sweating too much, they feel that their muscles are aching, they cannot go out as much as they want to, they palpitations, breathing problems, nausea, sickness, all those symptoms can be present, along with feeling low in mood, and even to the extent that they have negative thoughts about self, about the future and others and the world, and at levels no greater than specified for mixed anxiety and depressive disorders. The other one is with predominant disturbance of other emotions. When we talk about other emotions, we still say that yes, anxiety and depression are there, worry is present, tension can be there, anger can be there. Symptoms of anxiety and depression may meet the criteria of mixed anxiety and depressive disorders, which in itself is a more severe form of depression and anxiety. This category should be considered in children whom regressive behavior such as bedwetting, that's another important point. So people who have not able to adjust to the changing environment or the stressor, they go regress and start doing like bedwetting or thumb sucking, especially in older children, adolescents. With predominant disturbance of conduct, we discussed this already, especially in adolescents after the grief reaction, somebody passed away in the family, they become really aggressive and have dissocial behavior, meaning they are breaking the property, they are drinking alcohol, they are using drugs, and they are not regarding the respect for the others and for the property. With predominant disturbance of emotions and conduct, here both emotions and conduct is disturbed. We already talked about the conduct and the emotional disturbances, anxiety, depression. Thank you for watching. Press the like button, share with your friends, and subscribe the channel. There are more videos on mental disorders. I see you again.